Good afternoon, Professor Gibbs and the rest of Counseling 402 class. I do believe that borderline personality disorder would be the most difficult to both diagnose, and it is the one that we see professionally in an addiction ministry that is um, more often than not also diagnosed alongside um, with drug and alcohol addiction. But it does say in the DSM 5 that it's diagnosed without any symptoms of drug or alcohol abuse. It's unlike most of the others because in borderline personality disorder, you see people that are unstable in many areas of their life. Most things create a crisis. They have an inability to gauge the feelings of others and to usually not be able to make good judgment. Struggle to trust anyone becomes a loss of emotional control, and usually will have a past basis of their emotions that connected to some kind of trauma that's occurred in their life. One thing we must do as a professional caregiver is to be patient with the client and their emotions. Explain to them that their diagnosis does not define their identity. And of course, if we could not handle the patient, we would make a referral because it does take a good amount of professional psychological experience to diagnose these patients properly. We do have, Jesus Christ specialized in broken people. And before I began experiencing God's healing, I first had to succumb to his will. But never let the client feel as if their situation is hopeless, because we have a God that is the Lord of hope and forgiveness. I believe that this would begin the healing process for those suffering with borderline personality disorder.